Hello, everyone. Thank you for joining me for my webinar on leaky gut syndrome. This is by far the most requested topic that I get from my LinkedIn, Instagram, you name it. That's because there's so little good quality information out there about leaky gut syndrome. So I'm going to cover this today. Obviously, I cannot cover the massive amount of information that is out there from the research studies that's talking about leaky gut syndrome and its causes. In the next 20 to 30 minutes, my goal is just to give you as much information as possible and not make your head explode, but also just to help you know that there are things out there that you can do naturally to help yourself with leaky gut syndrome. So let's talk about what are some causes of leaky gut and how do you fix it. So before we get started, you probably want to know who I am. My name is Dr. Hines. I am a board certified chiropractor. My specialty is actually in sports medicine and preventative and rehabilitative exercise science. I actually run a multidisciplinary, or also known as a integrative medicine clinic here in Palm Harbor, Florida. But the one thing that has changed me is even working with all these physicians, we get patients coming in all the time that is overly medicated, have all these different type of health conditions. And what we realize is that it's hard to help someone dealing with chronic pain and different type of health issues if you don't address the gut. So with the team that I have, I'm one of the few to venture out on my own in this arena, which other professionals kind of stay away from it because it's so, it can be tedious because when you're trying to find out what's the reason for a person having different health conditions, you really have to kind of be the inspector gadget in the physician world. So what led me to move into the gut arena after leaving, I used to do auto injuries, I used to do sports medicine, like I said before, exercise science, is that when they said that 80% of Americans are dealing with gut issues, that means that no matter what I'm doing on the orthopedic side, that if I do not learn how to address the gut, then I'm have a lot more patients that's failing to recover properly and also to reach their goals. And so one of the things that I wanted to do as a physician is I wanted to kind of take that extra step and branch myself as far as away from the office as I possibly can. That's literally is branching out. So this is probably not going to be the most scientific presentation as you can see, because my goal is to make sure that you understand and that you feel empowered after this presentation. And at the end, I will give you an opportunity to be able to schedule some time with me or one of the other doctors who are participating in our Trust Your Gut program. And hopefully this is something of value for you. At the very least, if you can find something, what if you can find something in this presentation that can help you or one of your loved one or even one of your children find a solution that can keep them from having to go and get on more medication or some unnecessary surgery that's going to affect them. So what today's webinar will cover, I'm going to cover the what, who, when, where, why, and how, and maybe not in that particular order, but my goal is to cover those main points so you can have some sort of proper direction. Now here's the things that I won't cover. Now, as you know, as I'm a natural physician, I am not a medical doctor. And so by law, we must make these disclaimers that I am not trying to cure or treat any specific conditions or diseases. I am not trying to replace any current medical treatments that you may be undergoing. This is purely educational and for informational purposes. So consult your physician before starting any treatments, and you know the rest, blase, blase. Right? Let's jump right on into it. So on this slide right here, you probably see that there's different type of bacteria inside of the gut. But before we do that, there are some major definitions that I'm going to define to make this presentation more useful for you, but also there's some major things that you should know. So let's talk about this word intestinal permeability. This is where the word leaky gut comes from. The leaky gut phrase is a pretty much a layman term for intestinal permeability, which is a term that's described to talk about the material passing from a GI tract wall, which is what we also know as the gut lining, and then the rest of the body. Obviously, you've heard of viruses and bacteria or bacterium. What's major about viruses is an infective agent that typically consists of what we call a nucleic acid molecule in a protein coat. So instead of reading the slide, the major thing that you need to know about the viruses and the bacteria is that some of the health conditions are pretty much virus-oriented or bacteria-oriented. And the ones that are bacteria-oriented, those are the ones that can be the major components for things such as leaky gut. A lot of the viruses can actually affect the DNA. So without going too far down that rabbit hole, I'm just going to keep going through our definitions. As you can see them there, you can read quickly. The next one is probiotic. So you've obviously heard of probiotic. It's a substance which stimulates the growth of microorganisms. Now, the major thing that I left off here was the word antibiotic. Everyone knows what antibiotic, but when we take the time to break down these words, the word pro means for, and the word bio means life, and the word tic means an organism. So when we put the word together, a probiotic is a organism that is for life. So now you replace that word with antibiotic, a anti, which means against, bio means life, and tic means organism. You can see why antibiotics are no longer having their positive effect on human beings at this stage of the game. The next word that you see here is prebiotic. This is something that's talking about something that exists before or during the emergence of life. So the prebiotic, the first bacteria that human beings are supposed to come into contact, is actually from the birthing process. Yes, the birthing process. And the natural birthing process. Let me add that into there. Because one of the things is we don't see a lot of natural childbirth processes taking place as it once was. Well, when a newborn baby passes through the vaginal canal, the bacteria that it gets in its nose and its mouth on its way out of the birthing canal allows the body to actually jumpstart this good bacteria. There's some other things that we should look into that is really effective, such as like lotus births, which are leaving the baby attached to the placenta and the umbilical cord until it literally falls off, versus the clamping and cutting that we do in modern day society. Candida and candidiasis, these are fungal infections caused by yeast that belongs to the Candida group. Some of the 100 of Candida species can cause infections in humans. The most common is called Candida albicans, which I'm sure that you're familiar with. The next terms that I added, which is terms that have a very powerful impact on your understanding, is inflammation. Inflammation is a localized or physical condition in which which part of the body becomes reddened, swollen, hot, and often painful, especially as a reaction to injury or infection. So let's focus on the word infection. The infection is the process of either infecting or state of being infected. So when you're undergoing a chronic inflammation, especially in the gut, one of the things that actually happens is your body begins to go through a reaction, the inflammatory reaction, which is your body is going to trigger a healing process, which could be, triggering red blood cells, white blood cells, and other things of that nature. Gastritis, the word gastro means dealing with intestines, and itis means inflammation. So chronic gastritis occurs when your stomach lining becomes inflamed, right? We talk about inflammation. Bacteria, which can bother you, I misspoke. Bacteria, consuming too much alcohol, certain medications, chronic stresses, or immune system problems that can lead to inflammation. So when inflammation occurs in your stomach lining, it begins to change, and then you lose some of your protective cells. And this is why you hear about people talking about gastritis, ulcers, and even Crohn's disease. And what Crohn's disease is a chronic inflammatory disease of the intestines, especially the colon, the ileum, and also associated with ulcers and fistulas. So this is why you can see like colonics have become popular over the years. It's really been something that's been around for a long time, but colonics and the enemas and things of that nature. Now, I don't have enough time to talk about all those things, but I can tell you that those are some major things that you can do to help with your gut health. But we're going to carry on, and then hopefully I'll be able to chime back on some of those things of that nature. And so we talked about GERD. So you probably hear somebody talk about GERD, which is a digestive disorder that affects the lower esophageal sphincter, the ring muscle between the esophagus and the stomach. Many people, including pregnant women, actually suffer from heartburn or acid indigestion, and we also would label it as GERD. And the worst thing that you can do is have someone giving you antacids, which is against your acid when most of your stomach is actually acidic. Eventually, I'm going to do another webinar that talks about alkalinity and acidity, but for sake of time, all these things have can benefit from moving towards a more alkaline protocol. And the last thing is that I think it's important for everyone to know is we're talking about adrenal glands. Adrenal glands are responsible for releasing the 3 different types of hormones that controls a number of bodily functions. These include your metabolism of carbohydrates and fats, the cardiovascular system, and the correct balance of salt and water. Now, when we're talking about digestive systems, this is actually one of the 13 body systems. I know you might be looking at the chart and say, wait, I only count 6. Yes, there's a reason for that. These are all the 12 systems that is talked about in modern day medicine. Now, what we're talking about now is natural. So the frame of mind that you have to have is a little bit different than the traditional medicine and the traditional things that you're going to find on Google. So when you actually start to get deep into what controls the body and what makes the human being so special, you actually can see that when we get to the 13th system, you actually have a greater understanding of what those systems is. But you notice that the 13th is not listed here. It's going to be very difficult to find it any other place online, but I'm going to go through that. And some of you all who know me very well, you already probably know what that 13th system is. So some of the systems in the human body, we have the circulatory system, obviously that circulates blood, your digestive system, which helps absorb nutrients and remove waste. Now, this word endocrine system, before the 1930s, it used to be called the endocannabinoid system. Yes, your ECS system. That is something major, which is now why you're seeing why the CBD products and the medical marijuana products are becoming very popular, is because we begin to do more study and research on the endocrine system, and this is the system that affects your body's hormones. Your integumentary system, I'm tongue-tied, and also your exocrine system. It helps with your skin, hair, nails, and sweat and things of that nature. Your immune system and your lymphatic system defends your body against pathogens that can endanger the body, and also your network of lymphatic vessels. I also have another test question, and I want you to pay attention here. 80% of your immune system is located where? But I'm not going to tell you yet. I want you to think about it. I want you to write it down. You can even put it in the chat box if possible. The next one is your muscular system, self-explanatory. Your nervous system. Your nervous system now is the first organ to develop in the human body, which is your brain and your spinal cord. Your brain sends signals down to the rest of your body at over 274.5 miles per hour. What an amazing. Obviously, as a chiropractor, you know I'm going to get excited about this, but it's so amazing. That develops before the heart, liver, lungs, kidneys, anything like that. And that's why it's one of the only organs inside of the body that's protected by bone. The brain is protected by the skull, and the spinal cord is protected by the vertebrae, the amazing 33 vertebrae. Next, you have your renal and your urinary system. This is the system that helps filter your kidneys and push byproducts out through your urine. Your reproductive system, your sex organs, your respiratory system, your skeletal system, and your hemopoietic system. If I was Canadian, I probably would say that slightly different. Now, let's get to this number 13 that we don't now. This is not me making it up. This is just something that's been in the books around the world for many, many centuries, but now we're just finding out how powerful this is. And that 13th system in acupuncture and Chinese medicine, we talk about is either called your chakras, or also known as your. Come on, you got it? Anybody gonna say it? Anybody? Well, this is what we call the meridian system. So the meridians in Qi actually runs hand to hand. This is the essence of the human body. So this is what you will find in a living body that you won't find in a body that's no longer living. This is what ignites the central nervous system, and this is why this one was left out, is because this one has to do with our spiritual selves, which we were designed to be in tune with the earth and everything around us. And when a natural human moves away from natural resources, moves away from the natural standard of the living, it's not shocking that we will end up developing these abnormal, unnatural illnesses and diseases. So why wouldn't nobody tell you about that? Is because there's no money in cures, as you obviously know. But when we look at it, when we follow those 12 routes, let me tell you how this is not working out for us. Like in the United States, we spend over $3.2 trillion in healthcare costs. We consume over 75% of the world's medications. We only make up the 5% of the world's population, yet we're ranked number 37 worldwide in industrialized nations as far as being the healthiest. There's a reason why. It's because we all have lost a lot of touch. Actually, we lost touch with all the things that we hold dear, which is nature and the higher self. We're not going to get into, deep down into that rabbit hole, but I just want you to know that it's something that's different that we're doing here that other people are not doing. Because even when we look at ourselves compared to our other European neighbors, we still rank last amongst them. So people say, well, you add in, Mexico or India, something in there, and so that's what's making our numbers look bad. No, when you look at us compared to Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, UK, we are in the very, very bottom. We're still at the bottom of that. So with that being said, the answer to my earlier question, which is, where is majority of now when I only confined right now in the NIH.gov research where they said that 70%. But a lot of people are saying 80%. I personally believe it's 80%. And the reason I say that is because if you add the plasma cells to the immune system, it makes sense why a lot of people are saying 70 to 80%. So to show you how important the gut is, 70 to 80% of our immune system is found in the gut. Now, a lot of my chart got cut off here, but what I'm going to do is I'm going to highlight something. You see this part right here? This is all the bacteria that we should be exposed to by the time that we were born. Colostrum, a lot of us maybe have working moms or single moms, and you maybe weren't able to breastfeed or be breastfed by your mother. So this is where the introduction of formula, Similac, and cow's milk comes in. And so what happens is all the bacteria that you're supposed to be exposed to here, you're missing out. This is what jumpstarts your immune system. So now you inject, dairy, cow's milk, synthetic formulas into the diet, and now we're shocked that our children are developing allergies and skin rashes and all kinds of things at a very, very young age. And this is what woke me up, because both my children were breastfed up until 3 years. But the biggest mistake that I made was allowing them to continue to eat dairy products afterwards. And so we'll talk a little bit about that. But one of the things is most mammal species do not continue to eat and drink dairy products after the nursing age. In our society, we drink milk to the very end. Actually, we eat the cow that produced the milk as well. So, not trying to jump off any vegan tangent or anything like tangent like that, but I just want to kind of share that. Look at the data doesn't lie. So if you don't have the bacteria colonization being presented here in the beginning stages of life, you see you starting back, body fighting already, and this is why we shocked that our children already constantly carrying fevers and ear infections, sinus issues, and to make this all worse, you take this and you add things such as vaccines and antibiotics and all these other things to the child's immune system is not even developed yet, and we're just bombarding it, especially if you're missing these two steps, these big major steps right here. So I am actually going to be doing another detailed webinar on this alone, because just to going through just the normal process of where we should be at by the time we reach an early adults, it's no wonder why we seeing kids allergic to peanuts, allergic to everything, shellfish, allergic to dust, allergic to sunlight, allergic to this, because the immune system has been destroyed and compromised by all these different medications and all these other things. And so I'm going to go through a brief list of medications and all this kind of stuff later. And my goal is just to inform everyone that, hey, something is not right. And we moved so far away from nature, and now we're starting to suffer the repercussions of this. Types of bacteria found in the gut. Now, these words are some nice big words, and I am not going to even try to butcher these words on here. I'm a young kid from Chicago, and I try to put these words together. I can tell you, that's a lot. Now, these are the 6 major types of bacteria: good bacteria and the 3 bad bacteria, right? Now, inside of these good bacteria and bad bacteria, they're actually broken up into even smaller categories. So what is gut bacteria? Living inside the gut, there are over 300 to 500 different kinds of bacteria containing nearly 2 million genes. Genes. Now we're talking about DNA here. So this is why it's really important to understand, like, wait, what is going, why is it that everyone's sick, and why is these conditions everyone keeps saying they're genetic? There's some cultures that are lactose intolerant, and we know that, just like a lot of African Americans are lactose intolerant, right? And so because a lot of these bacteria, they have different impacts and effects on your ability to be able to break down and digest materials. For example, there are some patients who are from Asian descent. There are certain bacteria and enzymes that are missing that will cause them to turn red if they drink certain types of alcohol, because their bodies cannot break down or metabolize the alcohol properly. Like a fingerprint, each person's microbiota or microbacteria is unique. So the mix of bacteria in your body is different from everyone else. Everyone else's mix is determined partly by your mother's microbiota. Okay, go back to birth. We talked about missing out on that breastfeeding and that first introduction of the prebiotics coming out of the birth process. And it's partly from your diet as well. So as you can see, this is not me saying this. You can find this on WebMD. Not saying that's the best place to find all your information, but when I was going through information, I like that they have more references that I can go and look up myself. So that's a little bit of anatomy quiz. As you can see, when people talk about they have acid reflux, well, here's your stomach right here. And this is your gallbladder right there. And you get your pancreas inside of there. Then you have your ascending, transverse, and descending colons. Now, obviously, you know what that is. And then we have what we call the small intestine here. And then this part, we call this the large intestine. Oh, there we go, right here. And so there you go again with your pancreas. You can see the gallbladder, and then it's the bile duct that puts things into the pancreas. And this is how all these things are connected. So you ever see why people say when they eat fatty foods it affects the gallbladder? Yeah, it's connected to your stomach. People talk about they have acid reflux. Yeah, why? Because it's connected to the stomach. People saying they can't sleep when they lay flat. Yeah, because all that stomach acid food, that rotten material, that acid is going all the way up, and this sometimes comes out of that area. And then also you can get other issues down here too as well. and we're going to talk a little bit about that in a few seconds. So let's get to the what you all came here for. Is what is leaky? What leaky guy? That's supposed to be leaky gut syndrome. I'll change that later, but for sake of time, I'm just going to do that. So please disregard my typos. Sometimes I type fast and I talk fast also. So leaky gut syndrome is a digestive condition that affects the lining of the intestines. In leaky gut syndrome, gaps in the intestinal walls allow bacteria and other toxins to pass into the bloodstream. When should I see somebody about the symptoms of leaky gut? Well, there is tons and tons of symptoms that you can have that will let you know that you have leaking gut. So first I'm going to go through the common clinical symptoms, which is for a lot of my docs who are on here right now. When patients coming in complaining of chronic diarrhea, constipation, gas, or bloating, poor immune system, they constantly sick all the time. We all know it, that somebody's around every time you see them. They got a Kleenex up to their nose, no matter if it's 90 degrees outside or negative 50 degrees outside. They're always sick. Experiencing headaches, brain fog, memory loss, fatigue, skin rashes, including eczema, craving for sugar and carbs, which also is another sign of mineral deficiency. If you're mineral deficient, it's a chance that you may be experiencing leaky gut, right? So if your gut is passing all your nutrients out, your body's going to crave them. And you see pregnant women experience this as well because of what they call pica or plica, whatever you want to call it, when they're craving like weird things such as, I'm not going to say weird, let's say different things, such as cornstarch and baking soda and things of that nature. That's because their bodies are minerally deficient. So some of the other things that are connected with leaky gut syndrome: allergies, flu susceptibility, nasal discharge, nasal itching, asthma, hay fever, depression, chronic fatigue syndrome, emotional disorders, lack of coordination, lack of concentration, mood swings, irritability, abdominal pain, burping, bloating, esophageal reflux, heartburn, vaginal discharge of burning, worsening of PMS, yeast infections, bladder infections. Yes, I skipped that word right there because I didn't know what it was. Actually, I've heard of it. It's vulvodynia, but you know, stop trying to beat for the sake of time. I'm trying to keep from holding up you all while I sound out these different words. Constipation, diarrhea, gas, irritable bowel syndrome, anemia, malnutrition, spastic colon, malabsorption syndrome, rectal itching and burning, diverticulitis, leaky gut syndrome, Crohn's disease, colon polyps. Now, rectal itching, by the way, I know it's like kind of like a side note. That actually has to do a lot with parasites as well, parasites and even worms inside of the digestive tract. So that's why a lot of people, when they go to our program, when we get to the point where we start detoxing, they start kicking small parasites and even small worms, because a lot of stuff can build up in your gut, especially if you're eating a lot of animal products, especially meat and things of that nature. Who may have leaky gut? Well, anyone who's have an autoimmune disease, thyroid problems, hormonal imbalances, celiac disease, IBS is irritable bowel syndrome, Crohn's disease, ulcerative colitis, food allergies, lupus, psoriasis, hives, acne, eczema, dermatitis, cystic fibrosis, asthma, arthritis, joint pain, depression, anxiety, ADD, ADHD, and more. And I can almost guarantee every one of these conditions right here, you always have heard someone talk about what nutritional protocol to help these. There's rarely, if any medication that can truly help any of these. If you're not, like Hippocrates said, let thy food be thy medicine. And people say, well, who in the family could be exposed to leaky gut syndrome? You got your father can have it, your dogs can have it, your children can have it, the mom, the sons, neighbors, everyone can actually experience it, especially if we all eat in the same way, especially if we all taking multiple medications. A lot of the dogs are eating processed food too. And now we're seeing dogs with cancers and tumors, which is mind-boggling to me. And now you actually see, you see commercials every single day of another child being diagnosed with cancer as well. And kids are supposed to come into the world pure. And all we have to do is go back and look at what toxin have this child been exposed to. Truly, human beings only have two things that would create illness or disease or dysfunction is either toxicity or deficiency or a combination of both. I mean, in medical language, we use it. We use the word hypothyroidism. Hypo means less than, hyper means increase or hyperactive. Hypothyroidism means low dysfunction. So you will always hear those words: hyper, hypo, hyper, hypo. Hyper means toxic. Hypo means deficient. And you can almost mark my word. If you look at all those conditions, you will see that they all have to do with some sort of nutritional deficiency or your body's ability to either produce more of something or less of something. When should I start working to heal my gut? And the answer is birth. Now, a lot of you are past birth, some 20 years ago, 30 years ago, 40 years ago, and even like myself, almost 39 years ago. And so is it too late? No, it's not too late. It's definitely not too late. As long as you're alive, you can do something about it. But there's a process, and you have to do that process diligently if you truly want to help yourself. You know, a lot of people go straight into the detox, and that's why they end up having problems, because when you start kicking things too fast, your body is going to feel miserable, and you're not going to stick to it. You're going to give up. I can almost guarantee it, because I've been through it myself. I've done lemonade, dyes, all these different types of cleanses. I mean, you name it, I've tried it. And I recently, in the past 6 months, lost over 100 pounds. I know you look at me, you probably think I didn't have 100 pounds extra on me, but I did. And I was a big power lifter. And I went from down to 389 down to 289. I did it in 6 months. And I'm still shredding it off by following this protocol. I can tell you, once you follow this protocol, I can introduce you to the next protocol in the maintenance phase to follow. And you're going to be so happy that you found me and found this protocol and program. Let's talk about some things that cause leaky gut. Now, this is going to get extensive. I'm going to talk about a few things, but let's think about this. The medications that cause leaky gut. Now, they're way more than this. But just for the sake of this slide, I just added a few. Okay. Antibiotics, NSAIDs, these are non-steroidal anti-inflammatories, steroids, whether it's prednisone or whether it's illegal steroids, whether it's you name it, anything with the OIDS, you can almost guarantee it's going to have, or IDS, sorry, is going to have an impact on your digestive tract. Birth control pills. And I'm not talking about things such as condoms and things of that. I'm talking about birth control pills. Anything that affects your body's hormones, this can have a major impact on your immune system. Acid reflux, and yep, here we go, chemotherapy. Chemotherapy, not only does it cause people to lose their hair, it affects the gut. And a lot of the patients that I see in my office are actually former cancer patients or current cancer patients that are dealing with neuropathy. And they're getting it in their hands and their feet because that's a byproduct of the chemotherapy in itself. And this is not me trying to knock chemotherapy. I know some people have their lives saved and their parents' lives are saved, but just to be honest, the number one cause of death for cancer patients is actually the treatment itself. Foods that can cause leaky gut. Wheat-based products. We always hear about, wheat this, whole wheat, 100% whole wheat, and all these different types of things. And I can tell you that no matter what it is, that wheat would inflame the gut. You always know, you eat a sandwich with wheat bread, you're going to feel bloated afterwards. Gluten-containing grains, barley, which is also found in beer, rye, bulgur, seitan, and that you always see in a lot of the vegan products, because I'm pretty much 95% vegan, 5% vegetarian, and it's only by personal choice. I'm not necessarily telling you to do that. I'm just telling you this is what I'm doing to heal my body, to heal my mind. After playing, years of football, dealing with concussions, I'm trying to do whatever I can to keep my brain and my body as healthy as I possibly can. Processed meats. We also know all these processed meats have tons of nitrates. Baked goods, all things that taste good. Yeah, right there. Cakes, muffins, cookies, pies, pastries, and everything else that you shocked that God didn't create because they taste so good. But it's hard to tell people in moderation, because I've never ate one Oreo and didn't eat a second one to follow up afterwards. Just me. Snack foods such as crackers and muesli bars and popcorn, pretzels, and things like that. Yeah, because they got corn. Corn is also another gut inflammatory food. Junk food such as fast food, potato chips, sugary cereals, candy bars. And look, I can almost guarantee we look 10, 15 years from now, we're going to see a lot of people dealing with gut cancers from all these Popeyes challenges and Chick-fil-A and all this other type of stuff. But this stuff is not meant for us as human beings to consume. It's not to consume it readily anyway. And then you also have dairy products. I know it's sad, but trust me on this. If you having leaky gut symptoms, you can figure out a way to get through these. Refined oils, canola, sunflower, soybean, and safflower oils. Yes, everybody say, oh, I use olive oil. You need to make sure that your olive oil is not disguised as one of the Chinese brands that they add all these different things in there, including some vegetable oils, right? So make sure that you know that source. To be honest with you, if I'm going through a leaky gut phase, I'm actually trying to eliminate all oils, to be honest with you. Artificial sweeteners, aspartame also, that calls it, linked to Alzheimer's, sucralose and saccharides, sauces such as salad dressings and things like that. Coconut oil tastes the best anyway if you're going to use any type of oil, especially on salad, as well as soy, teriyaki, and hoisin sauce. All those things that you'll find in a lot of the Asian restaurants, sushi places, and things like that. Actually, if you was going to eat sushi, I would just tell you to stay away from all the teriyaki and the soy sauce and just pile up on the ginger, and you probably would be better off. But I hate giving like those small little gray areas, because the gray area means that's the area is going to be a green area for everybody, because you're going to go straight to that and do that over and over again. The doctor said I can, but I'm telling you not. Now I know it's football season is starting, and I can tell you these are the two beverages, and everybody's joining in on alcohol and carbonated and other sugary drinks. Now, I'm not trying to get on too far down the rabbit hole on that, but I can tell you it's a reason. The word alcohol comes from an Arabic word meaning alcohol, which means the spirit, which hence the word why they call it spirits, because it makes you unlike yourself and brings something into you that's not. You just think about it. Whenever you drink, you're not as coherent as you would like to be, and another part of you come out, and you like, I don't know where that came from. I was drunk. I was drinking. Well, not only is it affecting your relationships and your friendships, also in your criminal record, it's also affecting your gut. Why hasn't my doctor told me about this? Now, it may be shocking. Some doctors actually get paid more money to prescribe you a medication, drug, or surgery than they would if they actually found a cure. Actually, I can't even think of a cure that we've come up in our modern day that didn't have to be discovered on some sort of back-end website of a natural cure. In this country, it's very dangerous to actually even use that C word, which is cure, because you come up with a cure, and knowing that there's no money in cures, don't be shocked if you start getting knocked at and weird phone calls, okay? So below is a list of medications that can cause digestive issues. Now, this is not me putting this together. I'm literally just pulling the information for you so you can see. And let's go for a ride. So let's see what I'm talking about. So a glossary of medication. So I went and I pulled up all these glossaries of medications, and the glossary of medication talks about it's the guide to medication and it uses to treat many medical conditions. The glossary does not include all medications that may affect the digestive tract. The digestive system. If a medication you are taking is not listed here, check with your doctor. Check the warning labels, the black labels on these different medications. You Google them, you will find a lot of the side effects have more people in this country die from Tylenol than from AIDS because of the internal bleeding. Acetaminophen is people use it for to relieve fever and pain and things like that. And in fact, fever is actually a natural defense mechanism for your immune system. So obviously, if your fever is over 107 degrees, 108 degrees, you may be in a little bit of trouble, and you may need one of these medications in an emergency. But in general, when your body is fighting off infection and trying to kill bacteria and viruses, you don't really want to lower the fever in that case, because it may affect your body's ability to heal. Antacids, antibiotics. We talked a little bit about some of these earlier today. Anticholinergics, anticonvulsants. This is something that you also find In patients dealing with neuropathy, they give convulsants, or also known as anti-seizure medications, to people dealing with nerve pain and also things like neuropathy. So you're seeing people coming in, they have neuropathy and they've been taking Lyrica or gabapentin, Neurontin for years and years and years and years, and all they have is more neuropathy. They don't have any help from the symptoms, but that is the standard protocol that's given to those patients. Antihypertensives, anti-tuberculose. I'm just going to flow through these. Calcium channel blockers and keep going. These synthetic iron. So these iron supplements that you're getting from a lot of these places, you need to check and see where the iron is actually being extracted from. Laxatives, nitrates for chest pain, NSAIDs, non-steroidal inflammatories, potassium chloride. That's also people, they use it for all different types of conditions, especially high blood pressure. And then there are some vitamins. A lot of vitamins are not natural and they're not naturally occurring. A lot of them are synthetic vitamins. The FDA don't regulate all vitamins for a reason. So there are some good reputable vitamins. The vitamins that we use, I'm not going to tell you they're the best in the world, but we do a lot of work vetting them. And we have over 300 doctors in our group that we all use the same products because we actually get a chance to look at what they're doing. We can go visit the laboratories. We can see where they're pulling the things from nature, the farms, and everything like that. So we moving on, but a lot of the vitamins, you can actually overdose on some vitamins too as well, because sometimes too much of a good thing can be a bad thing as well. Now let's talk about how can you fix it. Now, if you want to do it on your own, go ahead, you can do it. Now, this is what I found online. I'm not saying I agree 100% with what this is, but this is what is found out on these medical websites that they're telling you to do to help you with your gut issues. Now, probiotic, dairy-free yogurt, okay, I can agree with that. Fermented yogurt or kefir, it's completely up to you. But like I said before, we talk about the dairy in our diets. But there's other natural solutions that's good, like sauerkraut and things of that nature, and kimchi and miso. Sourdough bread, I think if I'm going through an inflammatory condition, I'm taking a break on all the breads just to give myself, because look at what we're trying to do. The body is so toxic or so deficient from so many things, it's causing our immune system to break down. So what I'm going to do, if it was me, if my house caught on fire, I'm going to take all the furniture out of the house, and then I'm clean the house thoroughly, and then I'm going to put new furniture in. I probably will put some of the old furniture back in, depending on what condition it is. But I look at the human body the same way. So we got to take all the old furniture out and then put new furniture in. But before we do that, we got to put the fire out. And that's which is why we don't recommend detoxing straight out the gate. You need to put the fire out first. So then also you see good other vegetables such as eggplant and broccoli and cabbage and carrots. So they're telling you, this is what you're going to find online. By the way, carrots is not a naturally occurring, it's a hybrid vegetable. And so some of these nightshade vegetables you have to be cautious with, especially when you're trying to detox and trying to help heal your gut. And so we actually have a full program to detail a line item, day 1, day 2, day 3, day 4. This is what you need to do. And I'm going to go through that a little bit in detail. But I'm showing you this is the information you found online. And this is why everybody's on the webinar now, because they can't find someone that's going to take the time to go through it and try to help. Obviously, I'm going to present this same PowerPoint in a more technical fashion for all my doctors who are out there who don't like the fact that I use a lot of layman's terms. But in the grand scheme of things, the population is not filled with a bunch of doctors and scientists. The population is filled with just regular people like you and I. I consider myself a regular person. I go through the same regular thing. I pay bills and do everything like other regular people. So when it comes to, by the way, the reason why most of the doctoral language and the legal language is in different languages is to prevent us as the public from being able to understand what's going on. Even in legal terms, they call it legalese. And then in medical language, to make it very difficult for you to do this stuff on your own, they put it all in Latin. So that makes it very difficult. And they use all these big words and things like that to describe things. Instead of just using this in layman terms in which we can all understand, they want to be able to talk over your head and things of that nature. And I do not do that. I don't want to do that. My goal is to help people. And at the end of the day, when I leave this earth, I want people to say, man, that guy actually did a good job. That's like the greatest gift that I can imagine. Don't bring me flowers. Just come tap on the casket, like, man, you did a good job. Where can I get help? All right, so now there's a lot of tests that you can actually do. Some of these tests we will actually do for our patients if they go through our program and they're not doing well after 90 days or 8 weeks. Then there is usually some other tests that we would do, and those other tests will include either a urine test, a parasite test, a bacterial test, which is part of a multiple kit that we will actually drop ship to your house, and you can do it in the comfort of your house. Part of me getting into telemedicine is I personally I don't like going to a lot of doctors. I actually do not. I consider myself my own doctor, but I try not to go to all that stuff because who wants to go and pay all these co-pays and exam fees and just for somebody to come and talk to you for a few minutes. And I feel like this is the best way because not only are we going to spend time talking to you, we can also get more information about you. We're not rushed because we have so many patients waiting on us and things like that. But all these things we're doing is just for the benefit of the patient. And to be honest with you, it's like one of the greatest pleasures I have when I can sit there and talk to somebody in the comfort of their home and they tell you, like, Doc, I'm so happy that I met you because I've been scared to go to the doctor. So I'm scared of what I'm going to find out. I'm scared of being put on the medication. I don't want to waste time. I don't want to take off of work. All these other things. And even a lot of medical doctors are beginning to see this. And this is why everyone's moving into telemedicine as well. And so these are some of the tests that we would do if you don't respond positively to our program. Now, most people respond very positively, but if you have more serious issues going on, these are the things that we would do down the line. But in order for us to get there, we have to go through this 3 phases of our process. And that 3 phases of our process, I'm going to cover a little bit. It's pretty extensive, but most people, they would do really well in that. So this is a test that we love to do. It's the easiest test, and it's all the tests requiring some sort of bodily fluid, but this is an easy test that you can do. You can do it at home. If you want help with this, at the end you'll be able to leave your email with me, and then you'll be able to have us take you can take pictures of it and send it to us. But this is something you can do yourself. And one of the things that we test when we are looking for gut problems is Candida. And it's a very simple test. You just take a glass of tap water and place it on your bedside before you go to bed. The next morning, before you do anything, you're just going to gently spit it in the glass. You're going to check to see the progress of your saliva every 15 minutes for 1 hour. If your saliva does any of the variation of the 3 pictures below, that's a sign that Candida overgrowth. If it stays grouped at the top or disperses, then that is a sign of little to no Candida overgrowth. All right. So those are the 3 things, and I can send you that in a second. I'm going to go over a little bit about the wellness survey that we also provide for our patients. Now we have multiple tools evaluation that we use, and we actually send this to you via email. And you can you can fill out this gut wellness evaluation, or you can send it back via email, or you can on your phone consultation. We can go through it, and then we can add up your scores itself. But what it is in medicine today, leaky gut, aka intestinal permeability, isn't typically diagnosed. However, that doesn't mean that it's not affecting your health. Many health issues related to leaky gut syndrome go undiagnosed, misdiagnosed, or ignored by traditional medicine. And it's not shocking because I just showed you a list of about 20 plus medications that, and who wants to be the one to have to admit that the medication they gave is now, you had it for your blood pressure. Now your blood pressure is still high, and now you got leaky gut syndromes, and now you have other kind of problems going on. So you just take the quiz, and you get the quiz back to us. We'll go over with you free of charge. This is a free consultation. And if we think that you're a good fit for the program, then we accept you in the program. Obviously, we can't take everybody because it's only 3 doctors in our group that's handling it. I'm actually recruiting other doctors now from California, people with functional neurology backgrounds to be able to help us with some of the neurological conditions as well. But it's really this first comes, first serve, and we open up this opportunity to everybody, but we just want to help as many people as possible effectively. We don't want to sacrifice the quality of the care that we can provide you. And so that's why we have you go through these steps, because it shows us that you're serious. And then we get to that point. If you're interested in the program, we'll give you the final details of that, and then you can move forward. Step 2. Set up a one-on-one phone Zoom consultation with one of our doctors. I am one of the doctors. Dr. Jasmine Patel, and we also have a medical doctor on staff. Actually, we got a couple of medical doctors that are involved in the program. But to be honest with you, we actually know more about this process because it's dealing with natural nature than a lot of the traditional medical doctors do, because it takes a long time to really wrap your head around how to put together a program that's going to best suit a patient naturally. So you set up your phone consultation, Zoom consultation with one of our doctors. The program consists of 3 phases over the next 8 to 10 weeks, and once you start, we anticipate you finishing it, because obviously it's not going to feel good when you coming off of coffee and sugars and bread. You need support doing that, and this is why you probably tried it before, but you didn't make it through, right? Yes, because I tried it before many times. I didn't make it through until I got myself an accountability partner, and that's what we serve as, is your accountability partner. So phase 1, the biggest goal for our phase 1 is to extinguish the fire, like we talked about in the gut, and then also to seal the gut. So once we do that, we go through the process of reintroducing different foods back to you so that your body can actually begin to absorb some of those nutrients so you can do well. Phase 2, now we're talking about detox and things of that nature, but this is a different process. There's a certain way to clear the debris where you're not detoxing and causing yourself to go through a heavy detox process. Think about it. Anybody that you ever known that went to any type of program, drug program, whatever it may be, and they try to detox, how do they feel within the first few weeks of detoxing? Feel better or worse? Yes, absolutely. They don't feel great. They feel worse. And so that's what will happen when you start off with the detox. You're going to have problems. You can work your way up to that process till your body begins to naturally no longer crave things. Sugar, on the other hand, it lights up the brain just like cocaine does. And so this is why we know that you got to go very methodical and strategic when it comes to getting a person off of sugar. Now, the fun part is the rebuilding the gut. This is where you begin to reintroduce some of the foods that you like, not the foods that led you to the gut problem in the first place, but it's foods that are better for you. And so we're going to do that slowly but surely. But the whole purpose of that is to make it where it's not painful, that you can actually start enjoying your life. But then, as you're going to notice, is weight may change, and the gut may go down here and there, and then your skin is going to start to clear up. When you start getting to that point, then we're going to move you into our wellness and maintenance phase. And that's the time that I'm going to introduce you to more advanced protocols, because now you're ready. You went through boot camp. Now it's time for you to go to BUDS training, which is Navy SEALs training. And that's the whole next level, which is full-on accountability and taking your health to the next level. So now you can start eliminating medications and all kind of stuff, hopefully with the help of your doctor. If that doctor doesn't help you, then you find another doctor and say, hey, look, I just lost 100 pounds. What's the purpose of me being on this medication? Hey, my blood pressure used to be 140 over 100. Now it's 117 over 65. Are you going to keep me on this medication? Last but not least, these are some of the references I use. It's more that's supposed to be in here. I should have put them all in there, but I know that there's so much information out there. You have to use a fine-tooth comb to get through a lot of the jargon, because sometimes it's very difficult as a patient. I mean, it's even difficult for me sometimes to even understand the massive amount of information. Now, out of all, this is probably one of the best right here, if I can highlight that. I thought that was a good abstract. You can find it on the NIH website. But without further ado, that wraps up our webinar. And I wanted to say thank you all very much for taking the time to attend this webinar. If you like it, like it. If you don't like it, please don't put a thumbs down, because I'm sensitive about my art. But if anything, I would love for you to share it with your friends, share with your family, and it's a regular conversation of a doctor that's trying to help his patients, no matter how far you all are. If you want to schedule a free consult, like I said, each doctor only can handle so many patients by themselves. It's literally first come, first serve, until the next group graduate. And the next group won't graduate until 8 to 10 months from now. We already have several individuals going through our program now. You actually may be on this webinar right now. Congratulations, guys, for taking that first step to changing your lives. But send me an email at gutdoctors@gmail.com. Gut, doctors@gmail.com. You send me an email, you send me a time that you want to set up a consultation, and what I'm going to do is I'm going to respond back with all of the paperwork that you need to fill out before we do our talk. Either myself, Dr. Jasmina, or one of our other doctors on staff. And when you're ready to go, let us know that you're ready to go. Otherwise, God bless, and hopefully you all find the solutions, and whether it's from this webinar or even in the future, hopefully that we all find healing in ourselves and healing in our hearts. This is Dr. Hines checking out. Have a good night or day or good evening.